Hello, everybody. This is Healthcare in the United States, created by me, Jetty Burkhead. And for my complex problem, I chose the topic of healthcare. Why is it so expensive? And how we can change things. Introduction. Hi, my name is Jetty Burkhead, 30 years old, and attend Miami University. This is currently my 6th year. My complex problem is healthcare in the United States and why it is so expensive. This is an important issue for all of us, no matter the gender, skin color, health, or wealth. Here's a really good quote I found while going through one of my sources in my bibliography. The dishonorable rise in healthcare costs has increased anxiety among Americans in every strata of society, inducing fears that a single hospitalization or illness could wipe out a lifetime of savings and saddle them with decades of debt. As the price of care spirals upward, millions are borrowing money, skipping treatments, and cutting back on household expenses in order to access needed health care. I don't know about you, but it doesn't sound good. I don't think it's right for somebody to do. Somebody needs to go to the doctor, they need to go to the doctor. Shame that people don't. Money. Money is the biggest issue among healthcare. About half of U.S. adults say they have difficulty affording healthcare costs. Many adults delay or go without medical care due to cost, with dental care services being the most common type of care adults put off due to cost. The cost of healthcare prevents people from getting needed care or filling prescriptions. Adults say their family member in their household have not filled a prescription, cut pills in half, skipped doses of medicine in the past because of the cost, with larger shares of those. Adults 65 or older report difficulty paying for health care. This can include services not covered by Medicare, hearing services, dental, prescription drug costs. Here's some charts I found while going through one of my sources. Large shares of uninsured Black and Hispanic adults and those of lower incomes. Somewhat difficult, somewhat easy. Insurance among ages 18 to 64, insured, uninsured, race, household income. Who has difficulty affording their prescription drugs? Percent who say it's difficult to afford the costs, 25%. Total drugs, prescription drugs, 33%. Here's the ages, household income, and race. About 1/4 of U.S. adults are not taking medication prescribed. Fewer have tried to obtain medication outside the U.S. or taking donations. Percent who say in the 12 months living in their household have done each of the following due to not filled a prescription, cut pills in half, skipped doses of medicine, purchased or attempted to purchase prescription medicine outside the U.S., traded, purchased, or accepted donations. 23%, that's crazy. Even the 10%, 8%. Household income, race, gender. 4 in 10 adults currently have debt due to medical bills. This was pretty crazy to me. Percent who say they have following types of medical bills, such as child, spouse, or parent, medical or dental bills that are past due, or unable to pay, 20%. That's crazy. Medical or dental bills they are working off, paying overtime directly to a provider, 21%. That's high. Debt they owe to a bank, collection agency, or other lender that includes debt or loans used to pay medical or dental bills, 17%. Put on a credit card, 17%. Debt they owe to a family member, 10%. And yes to any of those, 41%. It's a high number. I wanted to include them graphs because it gave something to look at. I just think it's crazy that people suffer and don't go to the doctor. Stuff. I'm sure we all know somebody in our lives that's done that, or something. We all know somebody. Patient out-of-pocket expenses. Patient out-of-pocket expenses are going up. Patients are being forced to cover a large percent of their health care costs, while overall provider reimbursement is decreasing. Out-of-pocket costs include deductibles, co-insurance, co-payments for covered services, plus all costs for services that aren't covered. Put this picture in here because it's sad that people put off these issues due to the cost of health care because of how high it is. Now, while doing my research, I wanted to look at ways that, because what we currently have isn't working. But then I stumbled upon some stuff that said the system that we do use is nice, but I found some stuff that I didn't know before, and maybe some stuff could be changed into what we currently have. And this is one of the things: excessive spending in the United States wastes hundreds of billions of dollars every year on medical care that does not improve health outcomes. Seems to me that money could be used elsewhere. The healthcare system is at a crossroads. The country must contain costs through either massive government intervention, private sector competition, or a combination of both. That was a quote I found in one of my sources. So when anybody thinks of healthcare, usually what comes to mind is Canada. So I got to thinking, okay, well, let's research Canada and see what we could do. Maybe we could do something like Canada. Canada, what's different? Canada's First Nations have cultural perspectives on health and healthcare that are distinct from Western health perspectives, including among differences a framing of health, environment, and communal rather than individual, and a greater emphasis on spirituality and healthcare compared with Western health traditions. Canada Healthcare. In Canada, the national government funds health services. What I found, though, is trade-off is longer wait times instead of having to pay higher premiums. That's one of the only things that I've seen with Canada is compared to U.S. is U.S. you shorter wait times, you get in quicker, but Canada you will have longer wait time. Universality, and everyone has it and can use it. So we got to thinking, how can we change? Here's a picture I included. Thought it was pretty cool. Where are we going? Where's the money going? Here are some ideas. 25% healthcare spending stems from administrative activities such as billing, scheduling, insurance filing. Seems really high. Conclusion. I understand if U.S. couldn't guarantee healthcare for all citizens like Canada, but I think the spending in the United States healthcare system should be looked at on how they do things to reduce payments so Americans get coverage if needed. No one should ever go without care. I think we can all agree with that. 3 changes that can be made that I agree with, that I stumbled upon, declared by Regis College, and they are automated repetitive tasks, establishing payer-provided communications platforms, implementing changes such as Medicare quality caring reporting. Conclusion. I'm glad that I chose this complex problem because with the current inflation and raised prices, I believe that it should be looked into more. While researching, I found myself questioning how the U.S. currently uses the system compared to what changes could be made. That's one thing that I found while doing this project is I was trying to figure out how we could go from one system to like how Canada uses their system. But among my research, I found that U.S. system just needs some revision and looked at and tweaked in some ways. But a lot of people do like the system we have. They just think that a lot of changes need to be made. So that's where the second part of my essay was, where, all those three things, and, administrative and 25% spending and stuff. Just like how technology is always changing, healthcare policies should as well, to at least see how it's managed to make it beneficial to all. I included this picture on the right because it shows the teamwork. So through all this, I found that maybe the system needs tweaked. Can't keep something forever. Things change. Stuff needs revised. Here's my works cited page with all my resources I used. And I hope you enjoyed my essay, my presentation. Thank you for listening.